Did you know that about 150,000 Americans are diagnosed with colon cancer each year? In the United States, more than 50,000 people die from this deadly disease each year, and it's the fourth most common type of cancer. Though it's one of the most common types of cancer, yet many people overlook the early signs until it's too late. In today's video, we're going to explore some crucial symptoms that could indicate colon cancer, including changes in bowel habits, abdominal discomfort, unexplained weight loss, and more. By understanding these subtle but telling signs, you'll be better able to identify potential signs and take early action. Colon cancer, or colorectal cancer, begins in the large intestine, or the rectum. This cancer usually starts as small, non-cancerous growths called polyps on the inner lining of the colon or rectum. With time, these polyps can turn into cancer. Colon cancer can be influenced by lifestyle factors, age, genetics, and underlying conditions like inflammatory bowel disease. Let's now discuss the most common symptoms of this deadly disease. Number 1. Changes in bowel habits. One of the primary symptoms of colon cancer is a noticeable change in bowel habits, which can differ significantly depending on the individual and the stage of cancer. This may involve persistent diarrhea, constipation, or a feeling that the bowel isn't fully empty, often referred to as incomplete evacuation. Such changes may last longer than a few days and can become more frequent or intense over time. Diarrhea and constipation are both caused by disruptions in the colon's ability to process waste properly, as tumors can block or narrow the intestines, preventing stool from passing smoothly. A person might also experience a shift in stool consistency, often appearing narrower or ribbon-like, which may result from partial blockage of the colon by a growing tumor. Additionally, these symptoms are sometimes accompanied by abdominal discomfort, cramping, or bloating, as the presence of the cancer causes irritation or inflammation within the intestines. While occasional irregularities in bowel habits are common and often harmless, especially if they resolve quickly, the persistence of these symptoms could indicate an underlying issue, such as colon cancer. Number 2. Blood in stool. Blood in the stool is one of the most alarming and telling symptoms of colon cancer, often prompting individuals to seek medical attention. This blood may appear bright red or dark, giving the stool a tar-like or black appearance, depending on where in the colon the bleeding originates. When tumors or polyps grow along the colon's lining, they can cause small tears, leading to bleeding. While many might initially assume the bleeding is due to conditions like hemorrhoids or minor gastrointestinal issues, it's critical not to overlook this symptom, as even small amounts of blood in the stool may indicate a more serious underlying problem. In addition to visible blood, some people might have occult blood, which cannot be noticed with the naked eye and can only be detected through specific stool tests. Repeated bleeding, even in trace amounts, may also lead to anemia, causing symptoms like fatigue, weakness, or shortness of breath. This combination of blood loss and anemia is particularly concerning and requires a thorough medical evaluation to confirm if it's due to colon cancer. Number 3. Persistent abdominal discomfort. Persistent abdominal discomfort is a significant and often overlooked symptom of colon cancer. Ongoing pain, cramping, bloating, or a general sense of fullness that doesn't go away with usual remedies might be the early signs of colon cancer. This discomfort arises when tumors grow within the colon, interfering with the normal flow of digestive contents and causing blockages or inflammation in the bowel. As the tumor expands, it can cause the colon walls to stretch, leading to cramps or a dull aching pain that may worsen after eating or over time. Many people might dismiss these sensations as minor gastrointestinal issues, but when abdominal discomfort persists or becomes more intense, it could indicate a serious underlying problem. This symptom may also coincide with changes in bowel habits or unexpected weight loss, further suggesting an imbalance in the digestive system. Number 4. Unexplained weight loss. Unexplained weight loss is a critical and often concerning symptom of colon cancer, signaling that the body may be struggling with a serious underlying issue. This weight loss occurs without any change in diet, exercise, or daily routine and can be rapid or gradual. Cancer cells demand a lot of energy to grow and spread, so they can alter how the body uses nutrients, often leading to weight loss. Adding to this, tumors in the colon can cause inflammation, which further disrupts the body's normal metabolism and accelerates calorie burning. In advanced stages, colon cancer can block the digestive tract, which makes it difficult for the body to absorb nutrients properly and can contribute to significant weight reduction. Some people also experience a decreased appetite or feelings of fullness after eating only small amounts, further exacerbating weight loss. While weight fluctuations can result from various benign causes, unexplained and continuous weight loss is a serious red flag that should not be ignored. Number 5, fatigue and weakness. Another overlooked symptom of colon cancer is fatigue and weakness, which typically occur as the disease progresses. These symptoms can stem from several factors. First, as the cancer cells grow, they consume a significant amount of the body's energy, which can result in a continuous feeling of tiredness, regardless of adequate rest. Another factor is blood loss. Tumors in the colon often bleed slowly over time, resulting in a gradual reduction of red blood cells, or anemia, which diminishes the oxygen supply to tissues and organs. This can cause not only fatigue, but also muscle weakness and shortness of breath, making daily activities feel unusually exhausting. Furthermore, the body's immune response to cancer can release inflammatory substances that contribute to an overall sense of malaise and tiredness. Many people might brush off fatigue as a consequence of stress or poor sleep, but when it becomes chronic and unrelieved by rest, it's essential to consider it as a possible sign of something more serious, like colon cancer. Number 6, feeling of incomplete bowel emptying. The feeling of incomplete bowel emptying, often referred to medically as tenesmus, can be one of the potential symptoms of colon cancer. Tenesmus occurs when a person feels that their bowels are not empty, creating an ongoing urge to defecate even if little or no stool is produced. This sensation can be caused by the presence of a tumor in the colon or rectum that partially obstructs the passage of stool, leading to incomplete evacuation. Such tumors can irritate the bowel lining, causing inflammation and affecting the nerves responsible for signaling when the bowel movement is complete. This persistent urge without relief can become more pronounced over time, especially as the tumor grows or as other changes in bowel habits develop, such as alternating diarrhea, constipation, narrower stool, or bloody stools. However, it's essential to understand that while tenesmus can indicate colon cancer, it is also associated with other conditions like irritable bowel syndrome, inflammatory bowel disease, and infections. For those experiencing this symptom consistently, along with other signs such as unexplained weight loss, fatigue, or abdominal pain, consulting a healthcare professional is crucial. Thank you for watching. Colon cancer symptoms can be subtle, but being aware of changes in your body is a powerful step in catching issues early. If you notice any of these signs, don't ignore them. Consult a healthcare professional and take control of your health. Early detection can make a huge difference. If you found this information helpful, please give the video a thumbs up. And don't forget to subscribe to Health Vitals for more health tips and important information to keep you and your loved ones informed and healthy. Stay vigilant, stay healthy, and see you in the next video.